I'm Dr. Tom Larkin, and I want to welcome you to the Ignite DDS Oral Wellness blog. As many of you know, I'm the clinical director for Jamie Amos's idealpractices.com, but in addition to my duties there, I have a real passion for the niche of oral wellness, and I want to share with you some insights. I think you're going to find this particular area of practice an area of great potential that's being underserved. I want to share with you something that happened a couple of days ago, and it involved kind of a second opinion that someone sent me an x-ray of a friend that was having a periodontal issue. And it was the kind of thing that I'm trying to read a film on a attached text message, but the problem was so obvious that it was safe to make a diagnosis. And essentially, I had two questions for the person that sent the text. One was, why do you have your wisdom teeth at 50 years old, and how often do you see your dentist? And the response was they didn't know why they had their wisdom teeth, and they go to the dentist every 6 months. Well, on the film, the level of bone loss, starting with the third molar, was about 70%, and then went up to probably 50% on the second molar and 30% on the first molar. So, not knowing exactly what to do, being kind of in an awkward situation, I said, what I would recommend for you to do is to go see a reputable periodontist. I think that's a good starting point. With what you're showing me at this time, it's impossible for me to jump in without seeing you, and maybe that's where I would start if it was a family member of mine. So this person goes, makes an appointment for an evaluation with the periodontist, and then calls me. And I said, tell me exactly what the periodontist said. And the person said, well, the periodontist told me that I had a lot of tartar under the gum, and they needed to do an under the gum cleaning to remove the tartar. And I was like, excuse me, would you repeat what you just said? So yeah, I had a lot of tartar buildup. And I said, two questions, okay, and I want you to really, really remember. Did the word bacteria ever come up in the conversation? And the answer was no, definitely. Never mentioned any bacteria, just tartar. Did the word infection ever come up in the conversation? And the patient said, no, I'm certain. He never said anything about an infection, just really concerned about the tartar. And I'm thinking to myself, wow, we have so far to go. We have so far to go. This entire area, I see it being handled, the standard of care being so low, so low. And so what I want to do today as my introductory blog is I consider myself a change agent, and over time you're going to see some of the things that I'm doing, but we need to break some paradigms today, because even in dental school you're being taught some incorrect paradigms. And so just as kind of an introductory lesson, let's go over just a couple of things real quickly. The first one is I just want you to raise your right hand and say that you solemnly swear to never use the following words ever again. Tartar. Never, ever. It's stunning to me that a specialist used that word. Tartar sauce. I'm so grossed out by the concept of tartar sauce. After somebody uses the word tartar, I don't even want you to use the word tartar sauce again. Plaque. That's old school, okay? Are you talking to patients about the plaque on their teeth? Old school. Oh, one of my favorites. SRP. Wow. No wonder we have problems communicating with patients. No wonder the level of periodontal disease in our country is 60 to 70% in adults. Under the gum cleaning. Yeah. Gone. Okay. We need to be using different terminology, especially as we progress. I'm going to talk to you about relationship with physicians, and we need more professional terms if we're going to be on their level. So here's a word I want you to become really familiar and comfortable with. Biofilm. Okay. Periodontal disease and dental caries are biofilm diseases, and that's kind of the terminology that we need to talk to our patients about. The film on your teeth is alive, and I'm going to talk to you when we get into bacterial testing, how it's very, very easy to communicate what biofilm is once we identify that this is a living creature that's on your teeth, not tartar sauce. Oral disinfection. This is kind of my favorite phrase that I want to use in initial phases of periodontal treatment, because every housewife in America understands that the cutting board in their kitchen has to be disinfected, or else they're going to have problems with salmonella and poison their family, okay? They understand disinfections. Bathrooms are disinfected, kitchen surfaces are disinfected. And once we talk about infection in the mouth, then the solution for infection is disinfection, okay? So we're going to do an oral disinfection, and it involves these appointments, these instruments, this cost, these rinses, blah, 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 okay? So let's change our terminology, because the resistance points that I see in patients accepting this is we're using ridiculous terminology that has been around forever. And we need to change the paradigm, because to be perfectly honest with you, in relation to prevention, dentistry is pretty much a failure, okay? Nothing has happened in my 30 years as a dentist. And so I'm going to leave you with one thought that'll kind of suck you into this blog, and I'll explain this more in detail in the future. But we're going to go over flossing instructions, because what a better thing to leave you with than the latest and the greatest flossing instructions. So this is what I want to show you for your patients with periodontoses. This is a breaking, new technology, a new way. This is what I want them to do with their floss. Take it in their right hand if they're right-handed. Put their hand back and throw it as far as they can. Okay. Dental flossing in the presence of periodontal disease is contraindicated, and I will show you the clinical research to back that up later. The primary preferred method of treatment, and for me, for sure, it is gum soft picks, interdental stimulators. And we're going to talk about diagnosing periodontal disease more accurately by using a soft pick, and also by a treatment regimen that uses a soft pick. And soft pick comes in different sizes, and also there's a Proxibrush that are for larger spaces. But what I wanted to do in this introductory blog is to just kind of bring you into the concept that as a young dentist or even a dental student, there's a lot of things that you're being taught that are just not current. And so over a period of time in this blog, I want to bring you along into some of the things that I'm doing that's very, very exciting and cutting edge. Thank you.